So, Eimear, how was your week?
Yes, it's been a rather challenging time. As I think you both know, I just have had recent surgery for breast cancer. So that was a bit of a shock. But the good news is it was caught early. My surgeon was amazing, and I was out of hospital the next day, and I feel really good. And I'm back actually working already. So there we go.
That's a very quick
That's a
turnaround.
serious week, yeah.
Yeah.
Yeah. So, but it's all good.
Oh, well, thank you for joining us today.
No
Ali,
problem.
how was your week?
Um, I feel like I had a really good week now. How do you follow that up? No,
Exactly.
no, it was. I had a really good week. I had a busy week, but a really good week and a week of perspective. So we had some really good friends. Jenny, who went to university with us, and her partner come to visit us, and it was really interesting because I was chatting to Jenny, and Jenny works in the community dental service
Mhm.
in the southeast. And I asked her if she minded me saying this, and she said she doesn't mind. So I've checked, but she doesn't really like dentistry. And yeah, I that's the face I make too. But I find now people find it really condescending when I do that. And yeah, but it's true because it's such a shame for people to feel like that. And the thing is, Jenny was saying, but I try to make up for it by I come in early to prepare. I work hard. I apply myself. The people who are uh, above me in this chain really appreciate me. And she finds my passion laughable. Like she actually thinks it's hilarious when I find something interesting. And I just found it really interesting and thinking about like, what if I was doing a job that I didn't love?
Mm.
And I think it's difficult because I know Emer is really passionate. I've known her for long enough to know that actually she's inspirationally passionate and we're passionate. And yeah, I just it really made me reflect. But more than anything, it was like, getting together with people who are your people and who it feels like home when you're around them. And it's important for us to regularly have that. So it
Mm.
was a really nice weekend. But as a week, it was really interesting because we've gone ahead and we've ordered a sprint ray
Mhm.
from
Oh,
ESM.
Mhm.
What does that stand for again? Do you remember?
well, it's
Mark
Mark
Barry's company.
Mark Barry's company. Oh, I do.
Yes.
Um,
Everyone knows Mark. Mark's
yeah,
awesome.
he is
Um,
awesome.
yeah.
Um,
No
the
idea
name?
what it stands for.
Yes. Oh, how can I not remember? Anyway, Mark's gonna love me. But what's really cool is we did a lot of research, and as I've talked about in previous episodes, we've been setting up a lab. And the more we looked into 3D printing, the more it just made sense to get it. So I'm really excited about that because of complications with putting in an extra compressor and limitations to the building at the moment. We weren't able to get a Zircozan milling machine at
Mhm.
this point, but Zircozan have been amazing. They're a really cool company, really nice people, really
Mhm.
efficient, and it's going to be where we're going when it's needed. So yeah, that's been the week. How's your week been?
Well, I've had a lovely week. I've been in Italy for a wedding
Oh,
in,
jealous.
in Tuscany. I've had lots of heat. It was stunning, but I think I was delayed flying back again, and I think the universe just doesn't want me flying. It knows that it's not very
2 weeks of it.
sustainable, and
Yeah.
it's just telling me off clearly.
What happened this time?
Oh, it was just delayed. There was a bit of paperwork that was missing, so we
Okay.
were sat on the tarmac for a couple of hours, and then
Missing
I
paperwork.
know.
Yeah. Yeah. Okay.
Yeah,
Oh, we've
Okay.
all
but
been there.
yes.
Yeah.
So this week we are joined by Dr. Eimear Keenan. Eimear received her dental degree from the University of Edinburgh, and she has run her own private dental practice in Edinburgh since 1996. She's leading the way for women in dentistry. She's the first woman to ever be president of the Association of Dental Implantology and works hard to promote women in dentistry in Scotland, England, Wales, and Northern Ireland. She was also the first female dentist in the UK to gain her implant diploma from the Royal College of Surgeons, Edinburgh. She has been using CEREC technology since 2008 and believes the increased success of her practice has much to do with the implementation of digital dentistry. She regularly gives talks on digital dentistry as well as women in dentistry. She is an award-winning dentist and has been interviewed as one of the top 25 private dentists by dentistry.co.uk. And we are honoured that you are joining us here today.
Thank you for the invite. I'm delighted to be here.
So what was your sort of journey to implant dentistry?
Well, at the very beginning, I started out in hospital. So I qualified in 92 from Edinburgh University, and I got offered a job as a house officer, and I was very excited because I thought that was going to be my destiny.
Mhm.
And then what I realized very quickly was that I really did not like, I'm pretty nosy, and I really didn't like not finding out what was happening with patients. So when I sent them off to perio or to cons, they never returned. And I was just like, oh, I wonder what happened to that person. So I kind of felt like my destiny is not here. I'm not satisfied, not finding out the happy ending. So I decided to go back out into practice then after a year of that. But I got really good grounding in oral surgery. In fact, so good grounding that with the first day when I was put in from being a student to being a house officer, it was like a week or 2 weeks of, transition. And then we were thrown right in, and only that I had the most amazing nurses that had been working there for 25, 30 years, because they were effectively, I would put the scalpel on the buccal mucosa where when I was doing an extraction of a impacted wisdom tooth, was day one. And I would be like looking at them, they'd be like, and then I mean, it's terrible when I think back to it. However, I had also a very good lady who was the head of oral surgery at that time. So I could go and get her, but she wasn't best pleased because she liked to get the Times crossword done by 10:05 or something. So if you went and got her, she'd be really grumpy. So I really had to try and learn how to do it myself. And it was an amazing experience because I learned so much in such a short time, but it was right in at the deep end. So, but sometimes as long as you're in a safe environment and people are helping you, that's sometimes the best training that you can get. So yeah, it was good. And then obviously I went into practice, and again, I had a boss who wasn't really bothered about the outcomes for the patients, and there was a dentist there that really wasn't doing their job properly, and I went to him after about 18 months and was like, look, there's all these patients and they're ending up with a root canal, they've just been in for a checkup, and I really do not think that that should be being missed to that level. And he said, oh, leave it with me, I'll deal with it. And how he dealt with it was he made the guy a partner, an expense sharing partner. And so then I just went, this is not my vibe. So I then set up a practice 10 doors up in a rented surgery from an old man who couldn't get any associates to work for him. And he rented me a surgery within his building. And it was all very tense because then my old boss, whom I actually really liked, never spoke to me again. And it made it really awkward for me, kind of locally. So I just then put my head down, got on with my work. But it was only on that day that I realized how hard it was to run a dental practice and look after patients. And then I was regretting it for quite a long time afterwards.
Making the decision.
Yeah.
Eimear, how would you feel if one of your associates went and set up 10 doors down?
I mean, I would be so cross, but I had said to him I wanted him to deal with it, and I had said, what I expected from him.
Yeah.
And from my perspective, I felt he was not dealing with the patients, because for me it was always about what the patient was getting, because my granny had no teeth, and that's why I became a dentist, because I wanted to stop people losing their teeth. So from my perspective, somebody not taking care of the patient was just like, no, I can't. I didn't train to do this. So yes, it was kind of wild. And he found out that I'd written some patients, and then he kind of threatened me, and it got a bit horrible. And I understand it from his perspective completely now, especially that I'm older. But I thought, I can do this just as well as him. However, maybe I wasn't so smart as I thought.
I'm really pleased you said you were nosy, because that's one of the reasons I think I really like dentistry. It is that being part of that journey and actually asking those questions and seeing sort of that development. I really feel like I need to know things.
And yeah, I mean, I think also when I was, I don't know, maybe 11 years old, I went on a little mission myself to try and find a good dentist. And I went every 6 months, I phoned up and made an appointment at the next one on the list, until I found one. And it took me till I was 14 to find one that I really liked. And at that point, she taught me how to brush my teeth. And I actually didn't believe her. So I believed that holes were caused because dentists used to poke holes in your teeth. And she convinced me that really, if you could brush your teeth and not eat so much sweet stuff, you would end up not having any decay. And I brushed my teeth the way she told me, to spite her, not because I believed her, but because I was like, nah, I don't buy that. But I'm going to do it. I'm going to show you that it's your fault that I get holes in my teeth, not mine. And then, of course, she was right and I was wrong, funnily enough.
Are we just letting go of the fact that Eimear, as an 11-year-old, was
I love
phoning
this.
around dental practices?
It's amazing.
It was kind of crazy. My parents, my dad's a builder, my mum's a housewife, so we had there's no dentists in my family, and my granny, obviously my maternal grandmother, had no teeth, so there was not a lot on dental education at that point, and my parents just thought I was bonkers. I mean, I kind of think they maybe still think that. My whole family call me the tooth bore, so that gives you an idea of, but they're all very glad because they've all had an implant, so so yeah, they're happy now.
Have you read the book, The Excruciating History of Dentistry?
No, I haven't actually.
I would recommend it, but it goes through sort of all the different beliefs that we've had through history, and it reminded me then of when they thought it was worms in the teeth.
Yeah,
which actually isn't too far removed from what bacteria are.
Carie worms, yeah. Yeah, actually, and Eimear got me into a few books that changed the way I think. So it's a good time to ask Eimear, any recommendations since we last spoke about books?
Well, I love is it The Diary of a CEO? Is that the guy?
Yeah.
I mean, I think he spoke actually at the BDA, did he recently?
Yeah,
I mean, he's inspirational actually. And also The Power of Habit. That's an amazing. That's absolutely phenomenal. So just small changes every day, rather than thinking, oh God, I've got to get up and run 3 miles and do that 3 times a week. Just get up and do like 10 push-ups or 10 sit-ups, but do it every day. Kind of like brushing your teeth, you know. It's the same thinking behind it. You know, if you do that 2 minutes morning and night, you'll get a lovely healthy dentition, or, you know, lots of things apply. Investing in your pension, really boring, but do it when you're young a little bit.
Yeah.
All of those things.
No, really important thing to say, actually, because we've got, you know, a lot of younger dentists who listen.
Yeah.
And I think that's one of those things that you hear a lot, but maybe you don't hear it from people who actually know, and it's a little bit more difficult to listen to like a financial advisor saying it, but actually just start putting away a little bit now is really good advice.
I know. I mean, it's so boring, but you know, you know, one of the things about humanity I can't quite get my head around, and I think we should adopt this new policy. But you know, I taught myself how to smoke when I was 17, I'm ashamed to admit. And I stopped shortly thereafterwards, but it was horrible. It made me sick. It was disgusting, but I did it because it was cool. Now, why do we then not invest the same amount of energy in doing something good for us, like brushing our teeth or going for a run? It's really, there is a bit of a weird thing going on with humanity that make us, so I think we should start telling children they're not allowed to brush their teeth.
And reverse it. Yeah, brilliant. But Eimear,
I'm actually joking, but you know,
we're going to clip that up and use that. Ex-ADI president Eimear says,
I know, but with little kids, the more that I used to show them that I cared, when I used to treat kids, the more I showed them that I cared about what they did, the more they were like, well, I'm not doing it. Whereas when I would go, I actually don't care if I look at your mouth, it's up to you. I'm really not that bothered. I see teeth every day. I look at everybody's teeth, and then they would just go, oh no, I need you to look at my teeth. And you know, it's just, people are weird, all weird, really.
Yeah.
You know, so we're wired wrongly.
I love the phrase you used. You said, I taught myself how to smoke.
I know, but it was hard.
Yeah.
I mean, it's disgusting. It is horrible.
It's amazing how we persist when there's like weird benefits. Yeah.
And when you think at 17 that you're going to be like in the cool camp, but you know, God forbid. What, did I ever make it in that? I don't think so. I was such a geek.
Brilliant. Oh,
well, I'm pleased you've swapped cigarettes for running now. Which marathon did you do this year?
Paris.
Oh, it's amazing.
Yeah.
How did you find all the training?
You know, I was listening to podcasts actually, so I ended up listening to Audible, and I don't know if you know this, but this was a really top life hack. If you've got a Spotify subscription, you get Audible books for free, which I didn't know because I was paying for Audible as well. Anyway,
I did not know this.
yes. So
Okay, thank you.
So then when I would go out running, especially if I was going out for a couple of hours, I actually just put in my headphones and listen to The Diary of the CEO or Power of Habit, or so I'd listen to these kind of inspirational books that were, you know, driving me forward. And in the beautiful countryside, even though sometimes the weather was inclement, let's say, it was, I actually found the training, I decided that instead of thinking about it as I have got to do the training, I thought about it, let's make training part of the journey so that it becomes the like nice part. So I'm going, and I went to a different place almost every time that I trained so that I would see a different part of Scotland. So, and I ran with different people at different times, my daughters, and actually my eldest daughter also did the marathon that day. So that was really cool.
Amazing.
Obviously a lot faster than me, but she is a lot.
So after you sort of bought your practice, what point did you go, I want to go into implants?
Well, so actually I set up a squat, so I didn't ever buy a practice. So I've never bought a practice. I bought a house and I put the practice because I started off renting that room. And then when I met my husband to be, we bought a house that was the same cost for the mortgage as it was that I was paying for the rent at that point. And put the basement, my dad's a builder, so he put the basement into a practice, or made it into a practice. And I started working in the basement of my house. So
sorry, Eimear, you know when you set up your squat as that rented room,
yeah.
were you branding and marketing separately?
Yeah, well, I was a separate entity. It was just for
Yeah.
me. So I was doing it, and he knew that. Well, that was the
Yeah,
agreement that I would be in charge of my. And I mean, at a point, I did actually consider giving it up because I was working on the NHS, and my sister was reminding me about this the other day. We used to fill out those forms, you know. Well, you probably maybe didn't have them, but they were called FP17s and stuff.
Yes.
And you had to put in everybody's name, address. I had to do that by hand every day, and then at the end of the month, drive down to the dental practice board and drop those in to get paid the next month. And you know, also my rent was costing almost as much as what I was turning over because I was working on the NHS and I didn't have a big capitation or you know, I didn't have a big list, a continuing care list, and it was just really hard. And I had to buy an autoclave and an X-ray machine. So it was definitely a challenge. And you know, I said to my dad, oh yeah, it'll be fine. I'll have it up and running in a couple of years. And my dad went, I'll say to you, because I've run my own business, it'll take you at least 5 years. And he was right. It took 5 years for it to be kind of over the hump of being really, really hard.
Do you think
Not
that
very
still applies?
profitable.
Yeah. Do you think that still applies? Because you know, outside of dentistry, a lot of people quote 3 years, but that's not been my experience. And I think I wish people talked about 5 years in
It's 5.
dentistry.
It's definitely 5. Before, I mean, the thing that what the problem is that at that point, your peers are earning quite good money because they're still associates because they're getting a higher percentage of what they turn over. Whereas when you're the owner, you're the last person to get paid. You know, I think I told you about that book, Leaders Eat
Leaders
Last.
eat last. Yeah.
Yeah, so by Simon Sinek. So that's kind of true. I mean, it is definitely true. So from my perspective, I went into it with these rose tinted glasses thinking, oh yeah, I was only getting paid 50% down the road, and I would have bitten his hand off after a year for 50% of what I turned over. So I mean, I would have paid him to take me back on, and that was kind of my mortal enemy by that stage. So yeah, it's hard. It's harder than people think, and it's a lot more expensive to be the boss than you think. So yeah.
So 5 years in the new building and things got better?
So then I was in that building, and then after about, I think 9 months, I think it only was, that I then got into the house, into my own home, the basement of my home. And then, but it's still, even with that, and that was dividing the overheads between having a home mortgage and a practice mortgage kind of, I was still, it took 5 years. Yeah. I mean, I also had a baby quite shortly after that, which probably didn't help the business plan much.
How did you find balancing all of that?
I think because I did it with the practice in my home, that meant it was absolutely possible. And I have a big family, and my sister lived nearby, and I had support. I think and also I was young and ambitious, so those
You found a way.
Yeah.
anyway. But if I look now and I think of some of the girls that are working for me who are having their families, who are working as dental nurses and my dental practice managers and all of those kind of girls, they have to drive into the city, they have to drop their child at nursery, they have to then try and get into the town, park, walk to the practice, etc. And I just think that's okay if you've maybe only got one child, but once you've got two, it just becomes, it's the emotional energy is the problem. So it's the head space. It's not the physical even part of it. It's the actual, it's the strain on your brain, basically, I think. But I had made it as easy as possible because I didn't have to leave the house in the morning. So my daughter, we had a nanny. So I, you know, the one time I did put her in nursery, I very quickly got a nanny again because I was like, nope, can't cope with that. When she was young and waking up at night and, you know, then trying to get them up in the morning, they're not happy. You're trying to put them out to in the car. It's just hard. It's really hard. So, but I was very fortunate that I was in the basement of my home. So, and that made it, that's probably why I'm as a woman as successful as I am, because I had made my life as easy as it could be to have those children and combine it with working.
And what would you use as the definition of success now? So you're successful. What are the parameters in your life that are making you feel like, actually, you know what? I've ticked the boxes that I wanted to.
I'm getting to go on lots of good gigs all over the world. That's amazing. So I never thought that would happen, and I'll like talk to you more about that because I would like to encourage more females to do that. That was by a happy accident. I ended up there. Like a lot of my life has been a set of not very well thought out plans that just end up being okay. But the success for me, I guess, is having a lot of patients who have got beautiful teeth and their own teeth, and they now just pay a very, not a small amount, but like you'd pay for Sky or you'd pay for a gym membership to maintain the relationship. And I guess I convinced them at a very different time in dentistry, and I convinced them that the way forward was for me to do no dentistry and for them to pay me to not have to do dentistry.
I love that.
That was the way that I sold it to them, and I guess that has been the absolute baseline of the success. And then built upon that, obviously, all the other things that other things that I learned to do. But those were fun to learn to do because I got to travel the world to learn to do them. So yeah, it's all been good.
So how did you? This is amazing. How did you convince these patients that this is the right way forward?
Well, what happened was that at the time I went to the Eastman to do a root canal treatment update because I felt my root canals were really not as good as they needed to be, just because I didn't feel that I maybe had paid enough attention at uni. Anyway, so I went down and I did two courses. One was a light speed course, which has now become kind of obsolete. You probably won't even have heard that, but another one was the pro taper course. So I did those at the same time. I learned how to use I already was using rubber dam, but I wasn't using an apex locator and I wasn't using a rotary instrument. But then I came back and I was like, this is amazing. And so I started to use that technique and it was fantastic. But shortly thereafter, the new fee structure came out for NHS Scotland, and the price of the root canal paid for by the government was going to be the same price as the files or near enough. And I just went, no. But then I also felt I couldn't do a different standard. And I didn't also want to persuade people to come off NHS to get one type of treatment done. And I just thought that's going to cause me lots of angst and I will be not able to do that. I have to do one type of dentistry only. And it's the best that I can do every day that I turn up. And so I got the patients, I wrote to them all and I said, look, please come to the practice. I want to discuss with you the future of your dental health. I mean, this was back in the day and we had cheese and wine. So, you know, there was something nice for them. And I gave a little lecture about my vision for the future. And somebody had told me at that point, because I'd done quite a lot of courses, and somebody had told me that if you get half your patients to stay and pay twice as much money, you're actually no bit worse off financially than you would have been if you kept all the patients on the NHS. And I just went, that's logic. And that makes sense to me. So I don't care if I lose half my patients. I'm going to charge them the amount that I need to make it work. And lots of them went on to a plan that was run by Norwich Union at that time, which don't again even exist in terms of dentistry. And then it became Cigna. Anyway, it was a kind of a payment plan. So I had enough people by this second week to just stop doing NHS dentistry. So I gave them, a requisite, I think it was 3 months notice or whatever. I can't remember what it used to be, but I gave them all notice, and I said, the next time you come, it'll be the last time that you're going to get your dentistry on the NHS. And if you want to stay, you're going to have to pay. Lots of people chose to pay as they go, and lots of people went on a plan. So it was just a great trajectory from that moment on, because then I also felt I had to get my skill set to justify them paying me more. So then I just went on this continual learning pathway. So it was beneficial for me and them. And yeah, that was where it all came about.
Amazing. I think what's amazing, your sort of reasoning behind leaving the NHS is very similar to why I sort of moved away. And it's what's scary is actually the time between, and actually nothing's has changed. That is quite sad.
And also, I liked to treat people that were really, really scared of the dentist. So I'd done hypnotherapy and I'd done sedation training. So, and what I realized was that the remuneration for treating a patient who was terrified was the same as treating a patient that's really easy to treat. And I just was like, I can't afford to spend the time to get these people to be where I need them to be to have a good, successful outcome for their long-term dental health, because they need me to talk to them. They need me to get them to spend the time to talk about why they're scared, to then alleviate their fears, etc. And you just can't do that. And it wasn't I was looking for more money. It was just I was looking to make it pay enough to make it work the way that I felt.
Yeah.
I would rather have my teeth treated, because I didn't really like the dentist as a child. So as you can probably tell. So I wanted it to be that I keep my teeth and I want them to look as good as they can and be as healthy as they can. And people, they understand that.
I guess you took the time to communicate that, and you were bold about saying, like what a strange email to get from your dentist. Like, come and listen to my talk on a better future. How many people came to that?
I think there was like 100.
Wow.
Which cheese and wine. So
I kind of feel it was in Scotland and it was free cheese and wine. I think that was probably the second point rather than the chat. But yeah, there was a lot of people. It was really amazing.
That's incredible.
It was quite overwhelming. And I think by the third month, we had something like 500 or 600 people had signed up.
Incredible.
Wow.
So would you?
And they're still, most of them are still my patients.
Incredible.
Yeah.
I mean, would you recommend that young people who, the NHS was seen as an upskilling place at the very least? It can be a career, but at the very least, a place to get your numbers and get your skills up.
Yeah.
And more, what can be offered or what has been offered has changed over time for that service.
Yeah.
What's your advice to people who feel trapped in a system that doesn't have the resources to carry out the type of dentistry that feeds their soul and their morality? What would you suggest are possible avenues out of that?
I mean, if you're not the person that's in control of how you determine your own future, so say you're an associate and you're in a high deprived area, and et cetera, it is going to be a challenge, because but in Scotland, people do not like spending money on healthcare. Okay. And we're talking 26 years ago that I did this. And I've seen some posts on Facebook by people like Philip Barton. I don't know if I don't even know him, but I watch what he writes. And he talks about that if you persuade people of your passion to help them, then they invest in you and they find a way to find the resources to do that. And so, but I also think if you are trapped in that situation, you need to maybe just get your skill set to where you want it to be, use it as a way of getting you to be the best that you can be every day that you turn up. And then if you then want to do more courses, but the problem, I guess, for young people now is they have to spend so much going to uni, which of course I didn't have to do. And then you come out and you're still only at the very bottom of the kind of rung, of of your experience. So it's hard to buy experience because it's time served. So it's a difficult conundrum. But I mean, find people that inspire you and go and work there, because there are jobs and there are people that want to help to make you have a career that you're happy with. Because you've only got one life, is the way I look at it. Nobody, you're not coming back again. So, yeah, that's my advice.
Any starting points? If someone's looking to be inspired, they're working at maybe a big corporate, they don't have mentorship. Any starting points you'd suggest to get out into the wider community?
One, if you want to start doing more advanced types of surgical dentistry, like implant dentistry, the very first thing that you need to have is experience in oral surgery, because you cannot possibly do implant dentistry if you can't do surgery. So you could maybe do sessions at a local hospital, because there'll be people higher up in the team. You'll get exposure, because if you can't take a tooth out, you can't put an implant in.
Yeah.
It's very basic. It comes down to that.
Yeah.
I mean, obviously you've then all the other skills, suturing, etc. But you have to not be scared of cutting and suturing and bone, and and I think if you want a career in implants. I didn't start out wanting a career in implants because I had done I'd done occlusion training, I'd done sedation, hypnosis, I was doing restorative, I was doing lots of big cosmetic work. And I only got into implants because an implantologist, I know we're not really allowed to use that word, but he was a restorative consultant actually, came to work in the practice, a guy I had been at uni with. And we went from people, after each extraction that we used to offer them to go to the local implant practice, and nobody wanted it. They all just wanted a bridge or just keep the space. But when he came, he could do implants. And so they all started to get implants. And then when he was about to leave, he said, and of course, at that point, I had to learn what a healing abutment was and a hex and all the technology or the terminology that I didn't even know. And I started he worked on a Tuesday night. So I'd go down and just occasionally watch what he was doing and ask him about everything, because I just didn't even understand it. But anyway, move on 2 years, I think, from when he worked. He was leaving and he said, look, you're missing a trick if you don't go and learn about this. Go and learn how to do Astra implants, because they're the easiest and even you will be able to do it. Damned by faint praise. Anyway, so I took myself off to Birmingham, and under Dominic Hassel, I did his year-long implant course. I flew up and down to Birmingham, and it wasn't easy because I had my third child. I was getting up at 6 a.m. to fly down, to then work all day doing that, and then fly back and then work in the practice the next day, and manage 3 children. So it was, challenges.
Wow.
Oh no, maybe actually, sorry, I only had 2 children at that point. Or did I? No, maybe I had 3. I can't remember. See, I've lost my Anyway, I had a few children. I did have Christina. Yeah. So it was intense. It was hard.
Wow.
Yeah. So
amazing. Is there any courses you'd recommend now for someone starting out, like in implants?
I mean, to be honest, I do think you need to have a good grasp of general dentistry, because obviously you're putting something into your mouth and you have to understand how it fits within the whole dentition. And also you'll make your life a lot easier if you're into prevention, because we need the soft tissue, etc., to be really, and the biofilm, etc., to be controlled. So if you're doing implants, you want to understand and be teaching the patients all of that. So courses, I mean, there are lots of really good courses, but I think the most important thing is to get someone that will give you some form of mentorship, either during the course or shortly thereafter. Because I think if you look at what happens in practice with these courses, a lot of people do the courses and then they maybe practice and do implants for a couple of years, and then they get scared or something bad happens, and then they just go, oh, too much stress, can't do it. And I know a lot of people who've spent the money doing the course and then haven't continued to work within that field. And now with all the tools that we have digitally, we should be able to work in a very safe and effective way doing implants, in a very controlled way. Obviously, you have to understand all the biology and physiology, but it should be that most general dentists who've got surgical skills at all should be able to place an implant, and that will be important going forward because we've got an aging population with most of their own teeth, so people are going to lose teeth. So yeah.
So understanding that general dentistry, do you think there should be sort of like a minimum amount of time that people do general for before taking that step?
I mean, I probably do think that there should be, but how would you actually make, because there's so many different people within our profession, and so many people have so many different passions, and how much invest. Some people are really young and they're really good at doing all of the things that they need to do, but I think you need to understand people as well, because you have to be able to deal with the patients, because that's as much a component of managing your implant outcomes as the actual physical osteotomy and place the implant, as we all know.
Yeah. And actually, that's the thing that we probably learn the most about, I think, when we start our careers, is dealing with people. And essentially what we learn to do is to mitigate risk.
Yeah.
So yeah, do you have any advice, for younger dentists about mitigating risk? Because the worry for me is that there's a lot of people paralyzed by fear of something going wrong.
Yeah. I mean, we can't allow fear to paralyze us, because then nobody's going to get any dentistry done. I mean, we're going to spend all our day writing notes. I mean, that's of no benefit to anybody. But I think what we need to do is make sure that we work within a team that's really well trained and supports us. Use all tools such as AI and audio notes or whatever, the latest stuff, to help you to do things as timely. And I guess one of the things for me is trying to do things always the same way, repeat, and then you have less chance of failure. Because I have worked with dentists that do, for example, even just composite fill, and they do a different thing every time they do it, and I'm just like,
Yeah.
how are you ever going to know if you make a mistake yourself if you don't do it exactly with the same protocol? So I think making protocols that you adhere to yourself and having really rigid rules yourself. But I think I told you I've been going through something with the GDC. I'm not going to get into what it is or what's happened, but I only found out very late on that my initial notes weren't recorded, and that's a massive failing, and it's regarded as a failure of duty of care, etc. And I've had to do a lot of soul searching about it all, and the whole practice has had to come together to really reevaluate the way that we do things, and that nobody slips through the net. But you need to audit, you need to completely. There was a point in time where, because I've been working for so long, I knew my patients so well, and this is one of the big problems when you get to know people really well. We weren't taking a medical history of every single person every single time. And it was only because I decided to do an audit on it that I realized how many times we weren't doing it. Because we had little kids that I've been treating since they were babies, and they're totally fine. I know their mum and dad. I socialize with them. I know they're healthy. But if I was pulled up by the GDC, so it's, I think,
tick the boxes,
but procedurally,
and have safety in place.
I think we need to be just aware, but we need our teams to help us to do that, because there's a lot to do. So you need to be working, and I think we need to honor our staff well by paying them better also. I've had dentists who work with me over the years, and they come in and cry about what kind of car they've got, and it's maybe like 100K worth of car, and then they're moaning to a nurse that's paid a fraction of what they earn. And I just think we need to be more conscious of how we come across and the way that we treat our staff. I'd much rather give my staff higher wages and pay less tax myself, if you get me, than it's a taxable, it's against allowable against tax. So I'd rather make a little bit less and give it to them rather than giving it to the tax man, because somebody takes it off you, so you might as well give it to the people you love.
Yeah, absolutely. And Eimear, how do you work with your team? Because I know you're a big advocate of working as a team. What are some of the things that you do that, you may not think of them as different because you've been doing them for so long, but how do you work with your team?
I mean, we've been to New York, Las Vegas. I mean, I know that's out there.
Eimear, this is my team. He's taking notes.
Honestly, we have gone with 2 conferences, I might add. But we do a lot of things together to show that we care. But, you know, one of the biggest things, we were talking about this just recently, is, and it's the same with us and our patients, if we get people saying thank you and saying that you did a great job, actually, that is worth a lot of extra pounds at the end of the month for people to hear that you like them and you care about them and you want to hear about what's going on in their life and understand their situations. I think that goes a long way. And, you know, we've done lots of really cool things together and had a lot of fun, although every day, clearly working with patients, not always fun, but yeah, that gets us through, because you've got those times to remember. You remember when everybody was, you know, on their best form at some meeting or other, or doing something. Yeah. So we've had lots of good times.
I love that. So how do you how have you worked it so that, do you do an annual conference? Do you take the whole team? Do you close the practice when you all go?
We don't have to so much close the practice now, but we did, for example, last year I was speaking in Athens. I think you maybe knew that, but my team flew out on Friday. So this time they didn't come and hear me speak. I mean, they hear me every day. So they just came out and they just came for the weekend then, which meant we didn't have to close the practice. So they just came Friday and we came back on Monday. So they got a holiday and we had just time, you know, doing nice things. So I think early days, I had to take them to a conference and do it as a, you know, it is all against tax, etc. I mean, now it's a bit less hard for me to do that because I've got more resources at my disposal, so it's easier.
And how do you, you know, sorry, I'm really interested in this because I think it's brilliant. How do you then you know, choose how to structure your team and how to build your team and how to reward your team and still keep them as they are still striving? Is it been because it's the right people, or have you had any strategies in place?
I guess I've always had an openness to letting people develop to their max potential, and a lot of the staff have known that. So I've then invested in, for example, my practice manager started out as a nurse and she's now the practice manager, and my treatment coordinator started out as a trainee nurse. She'd never done any nursing, so she went right through her whole training and everything, and then right up to being treatment coordinator. My individual, like the nurse I work with most frequently, she does all the CEREC and the staining and glazing and all of that. And basically at any point, if any of them showed interest in learning more, then I was like, yeah, learn more and I'll pay you more. And they know that. So, and everybody in the team can do lots of different skills. They've done their CBCT training, they've done their sedation training, you know, so, but every time they do that, rather than me going, oh, well, I've paid for that, so now you have to give me your life back, I go, okay, well, now you've got enhanced skills and responsibilities, and therefore I'm going to pay you more. So, but because we get paid more, the more that responsibility that we have, we get paid more. So I do all the surgeries and all the things that can go horribly wrong, and I get paid the highest amount in the practice, and that's because I have all of that burden of responsibility. So our job isn't just related to what we do day to day. It's also about the risk that you have of being sued, or, you know, the responsibility, I guess, at the end of the day. And my girls take a lot of responsibility off my shoulders, and that has made it easier for me to develop my surgical skills and soft tissue skills, etc., etc. So, because if you can get somebody else to do a job that you don't have to do, it is obviously gives me time to do things that only I can do.
Brilliant.
Amazing. Yeah.
Yeah, I love that. I love that.
So
but we've lost a lot of talent out of our profession. And
yeah.
I genuinely think I know that dentists are like, well, we don't get paid well on the NHS, so we can't afford to pay our technicians or all of our teams as well as we should. But actually the whole thing then just falls apart completely. So if we value what we do, we need to ask the patient to pay us more. And then if we get paid more, we need to share that with everybody so that everybody's lives are better, including, because the thing that my patients always say is, your team's amazing.
Yeah.
It's like, yeah, but there's a reason for that. And it's not, it hasn't been created in one night. That's a lifelong, I think we were working out the other day that the person that joined us most recently was 8 years ago. So yeah, so
Really stable team.
absolutely. And they know, you know, when the patient phones, they know who it is. They're like,
Yeah.
hi, da-da-da.
But that's also why you can do trips to Vegas and Greece, because it's long-term investment in a long-term team that are giving back, and you can give back to them.
But, you know, we also have to take the risk of investing in people that might not stay.
Yeah.
Because you're enhancing skills. And we had a nurse that went away and worked in another practice and was working in a specialist endo practice. And then she came back because she knows that we're the best.
Yeah.
I mean, the best to work for, not the best, the best to work
No,
for.
but you look after people, and sometimes they have to see what other things are like in order to see that. Yeah, that's fair.
So you mentioned talking in Athens. You do sort of quite a few talks now. What's been sort of your favorite one?
You know, it's kind of bad. I loved the one I just did in Miami. It was such an honor, and it was really cool to be, because I was on the stage with 4 guys, so that was really cool. And I was talking about DS Core, which was amazing because I think it's kind of reignited my passion again in dentistry, and I can tell you more about that in a minute. But
Please, yeah.
yeah, but just I'll tell you this little story about what happened. While I was out teaching in Bensheim, I was teaching about abutments and doing your own in-house CEREC, etc. And I got a message on Facebook, and it was from somebody from Exicad, and they basically said, we've heard your name, we know you're a female, we'd like you to come and discuss an exciting project. And I was a bit like, oh, right, okay. So I messaged back on Facebook Messenger, and they said, I said, look, yeah, fine, tell me about it. So then the woman wrote me back and said, oh, yeah, well, I said, I can talk to you when I get back from Germany. She said, oh, our headquarters are in Germany. How about you just come round now? And of course, me being crazy and Irish, I was like, sure. But then when I got in the taxi, and I couldn't speak German and he couldn't speak English, and I was like, where am I actually going? And I don't even know who I'm meeting. I've never met them. They've basically stalked me on Facebook. It could be anybody. But chance would be a fine thing. No, it wasn't exciting. It was actually the headquarters of Exicad. I met their head there, Christine, who was amazing, and she wanted to kind of, they never voiced this, but I can tell you now because it's after the fact, but they decided they want to showcase women. So they got myself and this girl, Christina, Christina's a technician who works down in Harrogate, yeah. And she had been working with Steve at Nexus previously. Yeah. She'd set up her own lab. But she told Exicad that she would like to work with me, and I would probably be a person that could get up on the stage. Anyway, to cut a long story short, they got me to train in Invisalign, which I was just like, oh my God, I'm too old. I just cannot be bothered. I genuinely, that was my attitude. I was like, no, I would just want to talk about implants. No. Orthodontics, that's far too slow. I can't be bothered with that. However, I did the training, and then these 2 patients that we saw, one was the cousin of my practice manager, and her smile has been transformed, and the other was the videographer for Exicad. So anyway, I won't tell you all of it, but I ended up going to speak in Palma, and our patient got on the stage at the end of the talk to show his smile. But the most amazing thing about it was that he just needed 1 implant, but he got 2 little veneers on his laterals because his teeth were so crowded at the beginning, but because we used Invisalign, he then needed the most minimal prep veneers, which meant that I've realized I've been a tooth assassin for my whole life. So I've had the Irish guilt now. But we are now ambassadors for, I mean, Josh uses Sure Smile from Dentsply Sirona, so it doesn't really, I shouldn't say it doesn't matter. But, you know, if you align the teeth, it's amazing if you can align them, and then you'll reduce the amount of invasive dentistry. And if you've got young people who are only in their 30s and you're doing invasive dentistry, you've got to think they're going to last till they're 90. So we need to be more considerate of the long-term consequences of the teeth.
Do you think that aligning and then implants go well together then, sort of?
I mean, I think aligning and everything goes well together after results, to be honest. I actually was pleasantly surprised by how straightforward it was to do it. Because I thought, just kind of putting on those wee fixings and oh no. But actually it was really quite straightforward, and the results were just, I mean, for me, I was even going, wow. And everybody, there wasn't a dry eye in the room.
That's amazing. That's amazing.
How
And by the way, there was a guy who's got a blue tick on Instagram, and my daughter was in the audience as well. She's 21, and she was like, "Mum, a guy who's got a blue tick gave you a hug and said you were amazing."
how do you think we can get more women then in that speaking space?
Well, Dentsply have done a thing first to 50, which was amazing. And they actually gave me speaker training way back, because I had just got my CEREC machine not that long before that. And I really felt like I wanted to talk about it because I loved it so much. And I spoke to my Simon, who was in charge of the team at that point at CEREC, which were a very small team. And he said, "Oh yeah, okay, we'll get you to speak." And next thing, I was going to Vegas to get speaker training. So it was just fortuitous, so lucky. I mean, Irish luck or whatever, I don't know. But anyway, I ended up there and I got this speaker training from these Americans. And I had been head girl at school and hadn't wanted to ever speak publicly again, because it was run by nuns and they were horrible to me and made me feel like I couldn't do it. So I was really reluctant to take a step forward. But my sister had given me a book, Lean In, Ali. I think I told you about that book, Lean In. So I'd not long read that, and it was all about empowerment of women, and women need to help each other. And then my sister was going, "You need to do more for women. You've got 3 daughters. Come on, you're really, you do so much in dentistry, but you don't speak about it." And then I got the speaker training, and the guy, this is the most important thing that he said, "It's not all about what you say, but if you're nervous, everybody in the room is nervous and they will feel uncomfortable, and then they can't even listen to what you say. So you need to, for them, stop being nervous." And it was amazing. It was like, oh, wow, okay. It's all about, if you care about the people you're talking to, then you don't want them to feel bad. So it just into my psyche just worked. And then from then on, I'm not saying I've never been nervous. That's a lie. But I haven't shown you, Ali, but I showed Steve Campbell the power poses. There's a thing on the top 10 best TED Talks, and one of them is about how if you use your body to release the adrenaline and make yourself feel more like confident, and it works. It's amazing.
You were doing this before your president's address at the ADI.
Yeah. And everybody's laughing at me, and I'm like, this works. And it does. So yeah.
Oh, brilliant. Okay, you were going to touch on this, so let's talk about DS Court. So you are a key opinion leader for Dentsply Sirona.
Yeah.
And in your role, the cool thing is you get access to the cool stuff first.
Yeah. Yeah.
So what is this cool stuff?
Okay, so DS Court is a global web-based storage platform for all of the files that we take digitally from our patients. And you can add in other stuff that you want to, like if you take your own photographs or you want to add in anything. But the most amazing thing is it uploads automatically from PrimeScan and the CBCT. So I can sit on a beach and plan whether I can do an implant. I know that's kind of tragic, but it can be done. But better than that, the most important thing about it is the patient can open up an email from us with their scanned intraoral situation and their CBCT, and you can have a voiceover with it to explain what they're looking at, why they've maybe not got posterior support. They can then turn the model around. They can show people on their phone, and they can look at the PrimeScan in high definition color. It is honestly, it's mind-blowing, because for patient education, and I'm talking even if you want to show people how to clean behind their lower front teeth, it's just incredible. And you could send every patient a scan of their own teeth and go, this is what's going on in your mouth today, and it's just incredible. So
that is brilliant. And actually, Eimear, I wanted to ask you, so you and I met through the ADI. We were both on committee together. You came in with change in mind. You came in with a mission. You changed a lot as a regional representative for Scotland. You introduced webinars for study clubs, so people who were very remote could access them. And this was the time before COVID, so this wasn't a normal thing.
Yeah.
You reintroduced the importance of study clubs and it being a community rather than just being an accreditation. And it was incredible. You were so inspirational. And then you went on to become ADI president. And maybe is it fair to say you affected less change as president than you did as a committee member?
Yes, but remember, COVID happened.
Yes,
So,
fair.
I mean, I've decided God's a man
Mm.
because I got COVID, first ever woman. No, I'm kidding. I'm kidding. No, anyway, so as soon as my presidency, the very first meeting we were supposed to have, I had to call it off. So that was my
Wow.
and it was and actually it was before they had closed everything and we had to call it off and it cost 40K.
Wow.
And they closed everything the next week.
Okay.
But we didn't get reimbursed. But I took the decision, along with the committee at that time, that we would be bringing people from all over the UK to London, and we would be adding to the spike. And it was the right decision, but we got punished because it was so. Well, I mean, it was just we'd done it before Boris called it, or whoever was president, or not president, prime minister. Sorry, at that time.
Wow.
I'm starting to be like the US Democrat.
Yeah, and sorry, that wasn't having a go at you, but what I
No.
wanted to ask you was, because it's difficult, because when you're part of societies and you're not on your own, you're not a decision maker, you're part of a committee. And for people who, we're talking about implants, but it could be anything. It could be BACD, it could be restorative dentistry, it could be endo. What is your advice to young people about having societies, about how they keep them strong and how they affect change and how they can be a part of the future of these societies?
Okay, so one of the problems on that particular committee was we wanted to reduce the size of it because we felt that it was not really fit for purpose in the way that we had envisaged. And we knew lots of study clubs were not performing, but there was a lot of resistance because a lot of people don't like change and want to keep things the same because it benefits them individually. It's not necessarily about the greater good of our profession. And I think partly there's a disillusionment in our profession, particularly at the minute post-COVID, especially the way that we're paid. And there's a kind of sense of like, what can I do? It's not going to make any difference. But the problem is if people don't vote, they don't get involved, they don't have a voice, then nothing changes. And we can't complain about it at the same time as not taking part in it. And you've got to be at the table to be able to make change. So and stay at the table in spite of all the difficulties. But Ali, as you and I know, it's not that easy sometimes being on the committee. If there's very dissenting voices and things get difficult, it just can be hard. So but we need more people to come through. We need more women to get involved. We need to want our profession to be the best that it can be. And it can only be that through equality, diversity, inclusion, and working with the patient's best interests at heart, not for our own self-benefit. So, yeah.
So, if there's any young people out there who go, oh man, I'd love to be part of these societies, but I don't know anything and I have no skills to bring to the table, what would you say to them?
100% get involved, because if you don't know anything, you'll learn from somebody else that's there. And you do know stuff about what young people need and what people want in terms of education and change. And, we decided to change things because we knew that there weren't enough women involved in implant dentistry, and that's still kind of the case. But those changes about making webinars and making it more accessible for women to join those study groups definitely helped. And we have moved forward. But if we're going to keep moving forward, it's only by being involved that it's going to get better.
Do you still find there's a bit of that old boys club element?
In the world of implant dentistry, definitely. And it's sad because there are also so many amazingly good and open-minded and very great human beings involved within the field of implant dentistry, and they're so supportive. But unfortunately, there's still a very off-putting look at me, I'm doing 500 implants. Well, actually, if you look at the statistics, there's not very many people in the UK doing 500 implants because you have to work too many weeks to be able to do that. So I'm just saying, there's a lot of bravado and there's a lot of stuff that comes out, and don't let that put you off. There are really lots of great quietly getting on with it practitioners that will help and mentor, and they maybe just need to be asked to take a step forward. And I think girls in particular, or women in particular, need a wee tap on the shoulder sometimes to say, you know what, your voice is as valid as anyone's. Take a step forward and be seen.
I know, I love that. What would you say that actually there should be that more onus on men to create some of that space as well?
It's I think actually the onus probably falls on the older females. I hate to say it, but there needs to be more women visibility. And once it becomes more obvious that lots of women are doing amazing stuff and they are up there and they're talking and they're getting the right coaching and training. And I mean, I think they need to support it in lots of areas because, for example, even photography, as an example, there's lots of, that's another skill set, and preparing a PowerPoint, that's also a skill set. And so those are things that require investment of time. And if you've got a young family and you're trying to learn how to do implants, you haven't got time to do that. So, you know, it's challenging, but I think you need to decide how much you can get involved, but stay involved. Don't move away. Don't get despondent and think, I haven't got the time and energy for this, so I give up. Just think, stay at the table or stay at the learning, and you know, it doesn't matter what age you are when you get there. I mean, I'm evidence of that. I did my first marathon at 54, so you can do it.
Brilliant.
Well, I've done the marathon, so now I can do the implant. That's what I'm
doing it backwards.
That's what I'm going to take from this talk.
But I think also don't be afraid to ask people. Like, I get asked, can people come to my practice and observe? And I genuinely have no problem with people doing that if they want to do that. And that's a very cheap way of learning something new, because you only have to take a day off and get there. And, you know, we have hosted people at the practice lots of times and they've gone back and invested in digital, et cetera, et cetera. So, you know, don't be scared to ask people that you like if they would mind, because often they won't mind. And especially when you're as old as me, you're just like, yeah, whatever you want to do, come on.
Great advice.
No, it's fantastic. I've taken so much from today. We've got just the dental quickfire quiz before we go, which we ask all our guests to enter you to earn your dental pearl, which is virtual.
Yeah, don't go sending letters in asking where it is. Yeah.
It's okay.
Which is your favorite procedure to do?
I mean, I do love placing implants, to be fair. So yeah, it has to be that.
What is your favorite scrub color to wear?
Navy.
Oh, nice. There you go. With no context, what is your favorite tooth?
Well, I was thinking about this. It's either central incisor or lower left six.
Nice.
I like how specific that is. Let's have that one.
Yeah.
Because it's the easiest one to work on of the molars. So, and also, as somebody once told me, it's the tooth that keeps giving because it ends up getting caries early, it ends up getting a fill-in, then it gets a root canal, then it gets a post-crown, then it gets extracted, and then you have to put an implant in. So
Brilliant.
it's the bite that gives the most to a dentist if it's not looked after properly, which is why we need to look after them all properly.
The most lucrative tooth in the world.
Exactly.
If you were just leaving school now, what would you want to do?
I still want to be a dentist.
Amazing.
Oh, Eimear, thank you. It's always a pleasure. And I've gotten so much through my career from you. I know it's weird because I don't ask you for help much, but the times where you have given help and guidance have meant a lot. And you're one of the people, you know, I hold you in very high esteem, but when I mention other names on that list, for me, I think you'll understand, because people like Bill Schaefer, I think of, like you, who have really been an inspiration and encouraging, and I'm very thankful for you. So thank you so much. Thank you for joining us.
No problem. It's been my pleasure.
Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the Dental Imaging Company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental Burrs will help you do it.